As a matter of fact, I do. This PDF was taken from my new nurse crash course if you're interested, but I thought we could also go over it here really quick. These are some charting do's and don'ts. Do, make sure you are in the right patient's chart. No. Do make sure that your documentation is in line with your professional license. This means that you don't want to chart things that are not within your scope of practice. You also don't want to do things that are not within your scope of practice, but same goes for the documentation aspect. Do make sure you're using complete descriptions and enough details. Do make sure you're avoiding nursing notes unless absolutely needed. Most charting systems are pretty thorough and adequate, and it's better to use all the little checky boxes than it is to hand type up a nursing note, of course, unless it's sort of an out there situation that you need to explain. Do chart precautions and preventative measures that you're using, such as bed alarms, seizure precautions, aspiration precautions. Do chart any interactions or phone calls with providers, as well as the outcomes from that conversation. And with that, I also like to document whenever I touch base with family members. If I put a phone call to the patient's MPOA, I document that as well. Do document if a patient refuses a medication or treatment, and always make sure you're following up by notifying the provider. Do chart in real time whenever possible. I understand we are busy. I understand that sometimes we can't do real time charting, but when we can, definitely chart real time. Now let's do some don'ts. Don't say will continue to monitor. This is in the future tense and it is unnecessary to say. Don't chart a symptom such as complaints of abdominal pain without also charting how it was treated. Don't alter a patient's record. Don't use abbreviations that aren't widely accepted. When in doubt, just type it out. Don't use inaccurate descriptions such as bed soaked or a crazy amount. Do not chart excuses. Don't chart what someone else said, heard, felt, or experienced except in critical incidents. And if you do have to chart something like this, use quotations based on what a patient directly said. And the last thing is do not chart ahead of time. We can't chart in the future. Even if you know what's coming up or what to expect, you're not there yet. Anything can change. Hopefully this was helpful. Let me know if you have any more questions.